So wonderful to see all of you here and to know that there are many more of you online. We had a little technical glitch this morning, so we started a couple minutes late, but everything should be taken care of now. So welcome to the 2022 Patient and Caregiver Head and Neck Education Symposium. Whether you're joining us in person today or in the comfort of your own home, or perhaps you're watching a recording back at a later date, we hope that you find this day educational, informational, and inspiring, as it has been for many of us who have come in the past 5 years that we've done this. So we are very happy to have everybody here today. And for those of you who have not attended this symposium before, this day is all for you. This is for the patients, this is for the caregivers, this is our way of trying to give back. We hope we are providing high-quality information that will help you in your survivorship journey, whether you are newly diagnosed or 10 years past treatment. We hope you will take the opportunity to interact with each other. It's nice that we have this space so everybody can space out while we're eating and feel comfortable. But we hope during the breaks and things, you guys will have an opportunity to connect with one another. And I want to thank all of the providers and speakers who are giving of their time today. It's going to be a great day. I'm confident of that. So relax, engage, and enjoy the day. For those of you attending in person, you will find a schedule of events in your folder, in your bag that you received at check-in. And for those of you who are attending virtually, the schedule was provided in your reminder email. So if you want to check in on what's happening when. For those of you who are attending virtually, as a reminder, during the lunch break and the breakout sessions, we won't have anything streaming at that time. So that's a great time to get out and enjoy the day, take a walk with your dog, spend some time with your family, whatever makes you happy. We will join back at 2 p.m. promptly for our afternoon sessions. For those of you here in person, you see the vendors out in the hall. There was a vendor who just got here from nutrition, so there'll be some new information out there during the breaks that you can check out. Our breakout rooms have been designed really to provide an opportunity for people to have conversations with one another, both in terms of other providers and other patients. We have 2 different time slots, so there's one from 1 to 1:30 and one from 1:30 to 2, but really this time is really for however you want to use it. If you want to spend the entire time in one breakout room, that's absolutely fine. If you want to bounce around a little bit, that's absolutely fine as well. And we'll have some volunteers who will be helping out in terms of helping you find the different rooms, because I know this building is probably not familiar to most people here today. We do have a recipe raffle, so if you have not had an opportunity to submit something and you would like to, there are some note cards in your folder. And for those of you who are attending online, you can also email those to Tasha. We will do a raffle right after the lunchtime, so everything that has been received by that time, you'll have a chance to win an Amazon gift card. So please share any recipes you think may be helpful. This year we are putting together a book that's going to be a resource for people who are newly diagnosed, and this will be part of that book, are the recipes that have been provided by patients and caregivers. I want to thank our planning committee. So this event truly takes a village to plan, and a lot of different people's input. And so many of these people, these names are probably familiar to all of you as providers that you've seen. But thank you to Jessie, Jocelyn, Amina, Jennifer, Hope, Lily, and Teresa. They are an absolute A-team and have really helped pull everything together for this event. I also really want to thank my patient advisory committee. So there's a few of you in the room who volunteered to provide your input after last year's event. And the input that we got really shaped what we did with our program this year. So thank you to those of you who are part of the patient advisory committee. We also have a lot of volunteers here today, folks that helped with everything from setting up to making sure that you guys can find your way to the breakout room. So I'd love for all of our volunteers to stand up for a moment so we can give them a round of applause. I think actually many of them are outside getting breakfast right now. So maybe we'll give them a round of applause later. And then exceptional thanks go to Tasha, who I can see getting breakfast right now. Tasha is truly my right-hand woman. She has helped. We've spent endless hours, particularly the past 2 weeks, pulling things together. So Tasha will get exceptional thanks from me when I see her later. All of our speakers and panelists have given of their time freely. Thank you to Stanford Cancer Center leadership, as well as people who have provided donations, philanthropic donations to support this event. It is not an inexpensive event to put on, and so if there are folks who are interested in supporting future symposium, you can contact Cliff Harris at the email that's listed here. For our virtual attendees, there is a chat function that you can use to enter questions for our speakers. We hope that navigating the web platform will be relatively straightforward, but if you're having challenges, please do email Tasha. She'll be keeping an eye on the chat, but also keeping an eye on her email. So if you have questions about the format, let her know. We would like to just reiterate that today is about a celebration. It's about a positive experience for everybody, so we would like to just request that all comments made on that web platform be positive in nature. Any questions are welcome, but we'd like to keep it positive.